Good afternoon, everyone, and welcome. My name is Melissa McVie, and I am the Education and Home Support Facilitator with the Ontario Association of Residence Councils. Thanks so much for taking the time to join us today for our live webinar, Courageously Living Through COVID-19 Together, Residents and Families. Now, before we jump in and introduce our guest presenters today, I wanted to go over a few quick housekeeping items. Firstly, you'll notice that we've muted all of your lines to eliminate some background noise and any potential distractions for our speakers. This webinar is also being recorded for education purposes, and it will be made available to you following our session today. We've protected some time for a question and answer period at the end of our presentation, at which point you can either unmute your own line or you can type into the chat box, which is located at the bottom of your toolbar. Today's webinar slide deck is also available to you in the materials section of that same toolbar. So without further ado, I'd like to welcome our two guest presenters, Samantha Peck, who's the Executive Director at Family Councils Ontario, and Dee Lender, Executive Director at the Ontario Association of Residence Councils. Welcome, and thank you, Sam and Dee. I'll hand it over to you now.
Great. Thank you, Melissa, for that introduction. This is Samantha Peck from Family Councils Ontario, and thank you for joining us for this session. We are living through unprecedented times with this pandemic. And so over the next hour, our goal, our hope is to provide a forum for a safe exchange of information, opinion, and emotion. So I'm joined by Dee from OARC. Just to, before we get really started, we're not social workers or counselors, but we're here to facilitate information exchange. And we really do believe that coming together as we are seeking solutions, and we're going to be working together for the common benefit of excellence for all residents and families. Dee?
Thank you, Sam. So as Sam said, we're so glad that you're with us. We look forward to this time together. We may not have all the answers to your questions, but we assure you, both from Family Councils Ontario and from OARC, that if we don't have the answers or the appropriate perspective, we will find out and we will get back to you. We were thinking that likely the best way to do this is Sam and I will produce a joint bulletin, and we will put that out on April 22nd with any unresolved questions that we just don't seem to have the answers for today. So we'll do our very best to gather the information, and we will put out an OARC and Family Councils bulletin dated April 22nd. The topic is Courageously Living Through COVID-19 Together, Residents and Families. Let's begin.
So here's our plan for our time together. We're going to kick off and just let you know a bit more about who we are, so who's FCO and who's OARC.
So you decided to join us today based on the description that you read. So today we will candidly discuss this unprecedented time. We will acknowledge how the COVID-19 crisis has absolutely reshaped our lives. We'll examine how we've risen to the challenge together with grace and with courage, harnessing collaborative relationships to find solutions and support. And then we'll turn to a time for questions and answers. I'd like to think that this is not and will not be the one and only time we're pulled together for this type of purpose. We absolutely need each other. We need to find support and encouragement together. And we need to have a safe place to voice our concerns, our worries, our questions, our celebrations, and our fears. This is that place. So with that, we absolutely welcome you.
So Family Councils of Ontario has a mission to lead and support families in improving quality of life in long-term care. We do this by supporting family councils to improve their effectiveness. We do a lot around public policy and system planning and the mobilization of knowledge exchange. We're a charitable not-for-profit, and we are funded by the Ontario Ministry of Long-Term Care. So our primary services are working with family council members and home staff. So we do education and training on how to create and maintain effective councils. And our overall goal is to facilitate effective councils and help them develop strong collaborative relationships with the home staff. And through doing that, change the culture in long-term care and ensure that the family voice is embedded in all systems and in the system and all decisions.
Melissa, thank you. So OARC, we are a not-for-profit association as well. We're almost 40 years old, and we are funded by the Ministry of Long-Term Care and membership dues. Our mission is to empower Ontario long-term care residents to understand their rights, share their lived experience, and inspire a better tomorrow. We're all about education. Education with stakeholders and the broader community about issues that residents face. We provide a venue for a collective voice. We advise on policy and regulatory development. We also contribute to positive culture change in society, broader society, and also within long-term care homes themselves. We produce a series of tools, resources, webinars, in-home support visits, collaborate with many stakeholders, long-term care stakeholder groups and researchers. Next slide, please. OARC's Board of Directors is currently made up of residents living in long-term care homes across Ontario. Each board member that you see here is a resident in long-term care and is in a leadership role in their respective residence councils. We have representation from Ottawa, Windsor, Sudbury, Newmarket, Oshawa, Burlington, Willowdale, Keswick, etc. Our vision for our association, for OARC, for the work we do, and for our positive culture change hopes is that every long-term care resident in Ontario shapes the place they call home. Living and working in long-term care has changed. Having a loved one live in long-term care now is not the same experience as it was even 5 years ago, let alone 10 to 15 years ago. Residents now are older, they're living with many more comorbid health challenges, and 70 to 80% of residents are living with cognitive changes that leave them unable to speak for themselves. There are many more younger people living in long-term care homes now too. And we've been challenged as a sector with recruiting, retaining, and securing human resources for long-term care. This has been an ever-growing issue, and we've seen this escalate over the last few years. Prior to COVID-19, we were already struggling with significant human resource shortages. For years and years, Dr. Bill Thomas, some of you may recognize his name. He is the creator of the Eden Alternative. Dr. Bill Thomas has said that residents in long-term care suffer from 3 plagues, and they are loneliness, isolation, and depression. Prior to COVID-19, volunteers and visiting family members were vital, an integral part of the care team, the lifestyle, the rhythm of every long-term care home. Large whole home celebratory programs and smaller intimate gatherings of 5 to 10 residents were commonplace and absolutely needed. The goal was to engage long-term care residents with their community, with children, with organizations, to seek opportunities for entertainment, for learning, for development, for self-empowerment. All of this has come to a standstill with COVID-19. Then, a few short weeks ago, when COVID-19 exploded in Ontario, everything changed. And added to the issues of loneliness and isolation and depression that we are constantly working to alleviate, those are compounded now with a sense of fear, grief, uncertainty, ambiguity. When will this end? As a society, we are shell-shocked. The ambiguity, the open-endedness of this new situation causes such angst. When will this be finished? When will it be safe to resume what was once normal activity and normal living? I remember a few weeks ago now, when my friend texted me that COVID-19 was in the first long-term care home. And I remember thinking, oh boy, here we go. Long-term care homes or congregate living establishments in our province became closed to visitors, and everyday activities changed drastically. Sam and I, a couple of weeks ago, had a call with the ministry, actually about a month ago now, when the ministry was contemplating the impact of restrictions on visitors. While we were in support of the restriction for infection control purposes, we were deeply moved and saddened by the impact that that directive would have on the emotional and psychosocial well-being of residents and family members.
So why is this webinar called Courageously Living? And it's because of the impact that COVID-19 has had on reshaping our lives. And we know that living, working, supporting loved ones in long-term care has always taken creativity, patience, love, and understanding. But we didn't know that it would take courage, especially not courage to the degree we've had to muster in the past few weeks. So what is courage? It's the ability to do something that frightens you, or strength in the face of pain or grief. And we continue to live and work courageously throughout this crisis. We're seeing examples of courageous living from residents, family members, home staff, team members, government leaders who are making those painful decisions with implications on quality of living for residents and family members. The visitor restriction has sweeping implications for families and residents, but we're still working through it with courage. So it's a new normal. That normal changes quickly as the pandemic unfolds, as government passes new directives, as media stories develop, and as the numbers that we're hearing reflect the spread of COVID-19. So in the long-term care sector, we're striving to protect the lives of residents, families, and staff team members. So some of the reshaping of our lives we've had to understand and adjust to are related to the messages and directives from government. There have been many, and on occasion, there's been new information every day. So here's the few that we're going to get into in more depth today. So the restriction on visitors, the emergency order that, among other things, gave home administrators the power to use their best and reasonable opinion to pull in additional staff members as needed, and the relaxing of the legislation so that the pool of acceptable people from which staff could be hired could be made bigger. The discharge of residents so that the leave of absence was suspended. So that's one thing we're going to talk about. What the communication that has to be delivered between from the home to residents and staff, and as well as testing as well. So we'll get into those in more detail.
Thank you. I had to unmute myself. So the first directive that we're going to touch on now is the restriction on long-term care home visitors. So only essential visitors are permitted, and that's defined as people who are visiting a resident who is gravely ill or who is dying, or those performing an essential service. As previously mentioned, we were and we are absolutely acutely aware of the significant cost, especially as time continues to march on, of the psychological and emotional health of residents and families, and also the practical and logistical things that are done, the rhythm of the home that is affected by this restriction. Volunteers and family members contribute countless hours and in countless ways to the quality of living for residents. The one obvious option to establish and maintain connection between residents and their family members is through technology, especially technological platforms that provide visual images of each person so that you can laugh and cry together, you can see facial expressions, you can look into each other's eyes. A couple of weeks ago, OARC and Family Councils Ontario and a fabulous group called Tech Coaches worked together to create a toolkit for long-term care and retirement homes that may need some guidance, some instruction, problem-solving ideas related to using iPads, laptops, phones, etc., to maintain this connection between residents and family members. The result is what we're calling our virtual visit toolkit, and it is now available. Sam's going to explain about that.
So we know that nothing replaces that in-person contact that people are used to having, but it's affecting all of us. And we also know that there are many homes across the province who, well before this toolkit came out, were setting up virtual visits. But for the homes that aren't already doing this, we developed a toolkit that'll help them work through the process of, what's needed to do virtual visits. What Wi-Fi do you need? What devices are recommended? So the tech aspect of it, but then also some best practices for making it successful. So around scheduling, some different challenges or barriers to success. So the toolkit's available so that you can use tech and not touch for now. So this toolkit has a guide for setting up visits and so on, but it's also got detailed tools for using different platforms. So Skype, Zoom, and FaceTime, so that whatever devices are available and whatever platforms are available in your home, we can help you use that to enable virtual visits so that families and residents can still spend time together and have, maybe not in person, but a face-to-face connection and maintain that social connection in a time of physical distancing. So it's on our website and OARC's as well. So you can find it there. If you're having trouble, please get in touch. We are here to help you make your virtual visits a success. Back to you, Dee.
Thank you. So at this time, we would love to have a little bit of interaction from those of you who have joined us today. So we do have a polling question. So if you would please click on the answer that best describes how you feel about this question. Do you think that virtual visits can help you and your loved one continue to feel more connected? And we'll wait just a few seconds. Do you think that virtual visits can help you and your loved one feel more connected? Yes, somewhat, or no? Melissa, I will ask you to take this just for a moment with regards to the results from the poll.
Sure, they should be popping up on your screen. We had 81% of our audience said yes, 15% responded with somewhat, and 4% said no.
Thank you. Thank you, Melissa. So, we know that in-person is best. And also the use of technology is highly dependent on team members in the home being available. So it does still take some coordination and some time commitment, resource commitment from the home. So the next ministry directive that we're going to touch on is the emergency order that was issued on March 23rd. It was first for hospitals, then long-term care on March 23rd, and then several days after that, the same order was given for retirement homes. It was due to be in place for 14 days, and it's renewable one time. In speaking with the ministry on this, I was told that the ministry is in fact, and this is in quotes, catching up to the reality that is happening in homes. So this emergency order was all about providing relaxed legislation so that homes would have greater flexibility and be able to access a larger human resource pool. So it created flexibility to draw on people who, in the opinion of the administrator, had relevant skill sets that could be applied, non-clinical. So for example, let's say that in a long-term care community in an area, there's a local restaurant that where the cook from the kitchen, let's say it's a Shoeless Joe's or a Kelsey's, the cook from that restaurant is out of work for now, laid off. That person may very well have the skill set to be quite appropriately placed in long-term care, in the kitchen in long-term care. Another example might be an educational assistant with skills of working with people who have special needs. They may have skills that would be applicable for PSW. They can't, the relaxation of the legislation, that one of the stipulations though was that they could not fill registered or clinical positions with unqualified people. So they would not be able to pull just anyone to be a nurse, for example, to give out medications. They could redeploy staff members throughout the home. So really an all hands on deck approach. So if team members in laundry could be better positioned providing assistance during meal times, then there was some flexibility to pull staff members from various positions in the home to put them where the greatest need truly is. They could also use volunteers to perform work if the volunteer is providing an essential service. And an example for this might be volunteers who are trained in assisting residents with meals. There was also, in this emergency order, decreased documentation and reporting requirements. So regular, secondary administrative types of documentation is no longer required. If it is essential, so for example, updating someone's care plan. So let's say a resident has a dramatic change or a significant, meaningful change to their dietary needs. Maybe they require minced food instead of regular food. That type of significant care requirement must still be documented. Critical incidents are required in terms of being reported to the director, but other regularly required items are not required to be reported to the director right now. Care conferences, physical examinations of residents can be deferred if needed. And the Long-Term Care Home Act is very specific about training and orientation that's needed for new team members and volunteers. That requirement has been waived just as long as the new team members have been trained in what is needed to ensure resident care and safety. So it's definitely not a let's open the doors and let anyone in situation, but the legislation requirements have been relaxed so that using their very best judgment, administrators and senior managers in the long-term care home have access to a greater pool of people. Today, this is hot off the press. Today, well, actually through the night, Cabinet passed another emergency order, and this is brand new. Premier Ford announced it publicly yesterday, but in terms of officially going through Cabinet, that happened late last night. The emergency order states that healthcare workers can only work in one site. This builds on emergency funding that was announced a week ago or so, through which the long-term care homes could increase the hours of part-time workers to full-time so they could work in just one home. Now, the caveat here is that it is not required as of today, but it will start as of 12:01 a.m. Wednesday, April 22nd. There are requirements for and I have the document here. Again, it's hot off the press. It was just approved through Cabinet. The long-term care home, beginning at 12:01 Wednesday, April 22nd, the long-term care provider shall ensure that any employee who performs work in a long-term care home it operates or maintains is not also performing work in another long-term care home. This emergency order must also be posted in the home in a conspicuous and easily accessible location. The team members are also required to be upfront and open with their long-term care home of choice that they are only working in that one setting. Next slide. Great.
So just to follow up on what Dee said, that change to staff only working at one site was something that OARC and FCO had suggested, requested based on what we've been hearing from families and residents for some time. So I think it's also important to keep in mind that your voices and your concerns are being heard and government is responding. Another change that's been made is around residents leaving the home. So you're no longer allowed to have any offsite visits, no overnight trips out for dinners, no more of the 21-day leave of absences. So the way it is now is if a family takes their person home, if a resident leaves the long-term care home, it's for the duration of the pandemic. You'd be discharged and you can't return until the pandemic is finished. This is an emotionally difficult decision and one that shouldn't be taken lightly. So the decision to bring a loved one home isn't something that we can advise for or against, but we do want you to make a well-informed and thoughtful decision. So we have been looking into how to create a tool to help you think through, is this the right choice? So that you're making a decision that is best for the resident, and the resident is making a decision that is best for them, and also for the family home to which this person is coming. So on the next slide, you'll see that we've been working with our partners to create a decision guide, and one has just been released that was developed by the National Initiative for the Care of the Elderly and CanAge. And so that is now up just hot off the press on the FCO website, and OARC will have it as well. So if you're thinking about, as a resident, leaving your long-term care home, or as a family member having your loved one come to your residence, this will help you make a well-informed decision because it'll walk you through things such as, the decision you need to keep in mind that if you bring your loved one home, you'd have to, if it's for longer than 3 months, have an assessment and then go on the waiting list to go back to that long-term care home. So your bed would no longer be yours in the long-term care home while you're with your family in the community, and other things like around medications, making sure your personal residence is safe. So this tool will help you walk through that decision so that it is in the best interest of your residents and your family within the community. So it's up on our website, so you'll have access to that there.
A further directive that was given, and it's gone through a few iterations, but it's directive number 3, and the one that we're talking about is dated April 1st. Long-term care homes must keep staff, residents, and family members informed about COVID-19. It's right in the directive. There's a subtitle titled Communication. The first line is long-term care homes must keep staff, families, and residents informed about COVID-19. FCO has recently taken the lead with another organization called CanAge in developing a resource for long-term care homes to use in communicating with families, because some homes do a beautiful job in that respect, and others seem to struggle a little bit more with regards to communicating. I know from working with our board of directors and hearing from residents directly, residents are also struggling to find out current, accurate information about the status of COVID-19 generally, and certainly very specifically in their home. OARC and Family Councils Ontario create regular bulletins as well that elaborate on ministry directives and share some pertinent information pertaining to COVID-19 crisis. So we are providing the bulletins as tools for homes to distribute to residents and certainly to families as well.
Like Dee said, we know that many homes are communicating well with residents and families, but we also hear about those who aren't. So one of the materials that we've created, similar to the work that OARC is doing, is a quick 10 checklist that homes can use to determine what information to give to families. So things such as the number of cases of COVID-19 in the home, what's being done around, rec therapy programs and so on. So as a home staff, if you're listening and thinking, what is it that families need to know and how do we communicate well? This is a toolkit that you can use. You can go through it, fill in the blanks, and give it to whoever hosts or updates your website or is responsible for those robocalls that are going out with information. So it's up on our website as well. So please use it to help improve your communications to your families.
Here you see examples of what our respective bulletins look like. They're produced almost every day, and a few of them have been written together, Family Councils Ontario and OARC. We're hopeful that you are aware of this directive to communicate with families, residents, and staff members. Our hope and intent is that OARC and Family Councils of Ontario bulletins serve to assist in the information sharing for residents and family members, respectively. OARC's bulletins are sent to Residence Council leaders and Residence Council assistants. They're often printed and distributed directly to resident leaders in the home. The Assistant Deputy Minister of Long-Term Care, his name is, or Long-Term Care Operations, Brian Pollard, he wrote in an email around the whole issue of communications. He said, "We sincerely appreciate the supportive communications that you've been putting out to assist us in keeping residents safe." If you're not familiar with the bulletins from OARC and or FCO, please let us know and we can add you to our distribution lists. They're also archived on our respective websites for your reference. At this point, we'd like to pause just for another quick moment, and we have a poll, another polling question for you. Are you satisfied with the communication that your long-term care home has been providing you regarding COVID-19. So it's not out to the media, it's you as a family or resident. Are you satisfied with the communication that your long-term care home has been providing you regarding COVID-19?
Let's give everyone another moment. The responses are still coming in. Okay, I'll just close it there. So you'll see our group is quite divided. We have about 45% of people responding yes, they are satisfied. 31% are somewhat satisfied, and 25% are not satisfied.
Thank you, Melissa. So let's dig into this a little bit further right now. This is such helpful information for us as organizations to best represent what you need. We want to have a bit of a short interactive discussion. We've prepared a few questions, a couple of questions, and encourage you to type your responses into the chat box, which is on your toolbar. So the first question is, what topics do you feel are important for your long-term care home to communicate with you about COVID-19? So what specific categories or topics do you feel are important for your home to communicate with you about COVID-19? So please use your chat box, and we will start to see a flow of comments coming in. Regular updates about whether there are any cases or not. How everyone is doing in your residence. Safety measures being taken within the home for residents and staff. Is there anyone with symptoms? More communication to residents on what the home is doing to have some interaction with residents. So that taps into the psychosocial, emotional wellness of residents who are in many, many homes are being isolated. COVID-19 cases in the home on a daily basis. And also if there are no cases. So taking the question out of where are we?
There was a few that came through to me privately. How are meals being handled? What is the actual plan for a resident that is displaying symptoms? And why are there new residents still moving in during a pandemic?
Okay.
What type of personal protective equipment is being used?
Great, great, great. Infection control practices, yes. Staffing issues and staff and resident health. What's the current status of positive, negative, and recovered cases in residents and staff? So thank you. Please keep them coming in. They will not go to waste. The second question that I'd like to switch over to now is, how is communication happening in your home? So what methods are being used by your home to communicate to you? How is communication happening in your home? So please use your chat box again to share this information with us. So I see emails. Email from the CEO, phone, Facebook, yeah. I just saw, a quick one, very terse. Oh, I don't see it now. Pictures, monthly newsletters, robocalls twice a week plus website. Thank you. Thank you so much. Nurse calling twice a week to update.
Dee, I'm just going to jump in. There was another sent to me privately, an automated calling system, like robocalls, and some family members are being referred to the company or the organizational website for updates.
Super. Thank you, everyone. So we'll move on.
So testing is one of the questions we've been getting a lot of, and what, as this little activity demonstrated, is families and residents want to know about what's being done in terms of testing in their home. So what we've been given in terms of information from the ministry is that long-term care homes are being prioritized for testing, and that increased testing has been defined. So specifically, if there's a resident with COVID-19, then all staff on the unit get tested, all essential visitors will be tested, all residents in adjacent rooms, and anyone else public health determines has come into contact with that resident. And we have been assured that there are sufficient tests to meet this increased demand. And this is something, again, where SCO and OARC have been in our talks with government, sharing the concern from residents and families about testing. So this is, again, one of the responses to the concerns that have been raised by you. And we're going to continue to discuss with government how to ensure that testing is done to its fullest potential in long-term care to help keep residents, staff, and communities safe. And back over to Dee.
Thank you. The last section of our webinar today, before we have a Q&A time, is just this. How have we together harnessed collaborative relationships to find solutions and support? Togetherness. We see it all around us on TV commercials, from our government, from our friends, our families and colleagues. We are in this together. We will get through this together. There is no one exempt from this concern. As social distancing drives us apart physically, we are, and we believe and we hope that we are coming together in new and creative ways to support one another through this crisis. Samantha and I have shared a couple of resources that have been produced out of this spirit of collaboration, all hands on deck, leveraging respective expertise and abilities to bring ideas to fruition. We participate, so Samantha and I, on behalf of our associations, we participate in several groups with multiple sector partners, including the ministry, to advocate for what is needed, and we are being heard. We have seen evidence of silos being torn down, of egos being put aside. There's very little ownership of ideas, just the sense of let's get help out to where help needs to be received. Out of tragedy and crisis, good things do rise. Blessings and lessons and new beginnings do appear. There are bright light ideas all around, and we wanted to just pause just for a moment to look at a few of these bright ideas, tools, and resources.
So one thing that is happening is we're seeing increased collaboration and connection between the hospital sector and long-term care. So this is a story from the East End Toronto Hospital, is Michael Guerin, and they've been working with different long-term care homes in the East End to provide additional staffing support. This is something that will likely change a bit in terms of how hospitals work with homes, given the new directive that healthcare staff can only work at one location. But in this example, there was a collaborative outreach team that had members of infection control, a geriatrician, nurses, and family physicians that reached out to long-term care homes to see what was needed. And so the hospitals have been providing support, information, personal protective equipment as needed. So that is one of the bright lights, is breaking down silos between different parts of the healthcare sector and really having everyone even more so recognize the essential role of long-term care in our healthcare sector. And I don't think that's something that's going to go away anytime soon. I think what we're seeing is an increased recognition of the value, the importance, and the role of long-term care. On the right, you'll see a resident who took a lovely photo for us and to demonstrate how technology is one way to help people stay in touch with their loved ones out in the community. So once again, it doesn't replace that in-person connection, but it's one way to maintain social connection during physical distancing. And then when we move to the next slide, you'll see a couple other examples. So on the left, an example of a family council-driven initiative to thank long-term care home staff. So respecting physical distancing requirements, but giving an ovation of thank yous. So that's one way to continue to build community and to build connection and collaboration, even when people can't go into the home itself. On the right, you'll see a campaign, and it's one that's been done in a few places across Ontario, but having a letter writing campaign. So there's a recreation therapy professor who mobilized people in her community to write letters to long-term care home residents. So people that don't even directly know someone in long-term care, they've been moved to create connections with people, with the seniors, older adults, and others who are living in Ontario's long-term care homes. It's a bright light. It's one connection that can improve quality of life and to maintain those so important social connections. And these are just examples. There are some of many.
One-to-one activities are really what we need to focus on now because of social or physical distancing. This has to become the norm. But what do we do? The link there is one example. This was provided to us, developed by Dr. Christine Toyer of Java Group Programs. She has created a free 12-minute webinar called Creating Calm, Simple Activities for Stressful Times. So there are handouts. If you click on that webinar, they can be laminated so they can be easily disinfected and brought from resident to resident with team members to facilitate this at a safe social distance. There are, morning affirmation. One of the activities is the 1-minute calming exercise. One is a round of gratitude, etc. There's also, I just learned today that the CLRI, the Center for Learning, Research and Innovation in Long-Term Care, has put out a resource called Boredom Busters. It will be in OARC's bulletin today with a link to that resource. So those are additional resources for one-to-one visiting and how to assist residents with their emotional, psychosocial connection needs within their long-term care homes. Letter writing, intergenerational opportunities with local schools, some homeschooling endeavors. Well, now that children are at home, many schools are organizing letter writing campaigns to residents, drawing, coloring pictures to brighten the days of residents, brighten the windows. The Registered Nurses Association of Ontario has a Facebook page specific for families to provide a venue for collective support. So you can look up of that resource as well. I also saw a news clip a couple of weeks ago because weddings are not happening right now. There were some florists who had wedding flowers already prepared, and so they were just freely giving these wedding flowers to long-term care homes. I thought that was a lovely gesture. Donation of personal protective equipment, PPE. many organizations, small community groups, people are sewing masks from their dining room tables and donating them. There was an article that was brought to my attention highlighting universities and malls, strip malls and malls that had meal trays, those plastic trays for their food court areas. They've donated hundreds and hundreds and hundreds of meal service trays to long-term care homes to provide assistance for residents who are now, many residents eating in their rooms. And there's a lovely shot of the window visits. A loved one on one side, resident on the other. So these are, again, are just a few examples of some of the bright ideas, some of the stories and ideas that we see that just cause us to smile and to exhale and to take a breath and to say, okay, there are blessings and good ways to stay connected. So let's pause now. We do have about 10 minutes left. We will have time for Q&A. And I know that there have been some questions that have been coming in through, even before our webinar started at 2 o'clock, there were some questions that came in. Sam and I will do our best to answer your questions. And again, if we are unsure of the answer, we will direct the question, to the appropriate party, we will find the answer, and we'll put out a joint bulletin on the 22nd of this month with any of the questions that are still left unanswered. Okay, so Melissa, I'll ask for your assistance, please, in this endeavor to answer some questions. Thank you.
I'm starting kind of with some of the earlier questions. One was around testing. Why are long-term care homes still receiving patients or residents directly discharged from hospitals without prior COVID-19 testing or pending for the result?
So this is Dee speaking. There is a directive, a recent directive that says that any person coming from hospital needs to be tested for COVID-19 before they are transferred to a long-term care home. I know that we just had a call this morning with one of the associations who brought it to our attention that public health units across Ontario are maintaining inconsistent practices with regards to this. But the intention of that directive is so that the person who is moving into long-term care from hospital, there is a known positive or negative result for that test. So the intention was to not have that person move into long-term care if they are indeed testing positive in hospital.
Okay, thanks, Dee. There was another question wanting to know what is being done, I think, to manage the risk of COVID-19 spreading on secure home areas or units. There isn't a lot of detail on that question. If Crystal's on the line, you're welcome to unmute yourself to give a bit more context. But I think the concern is that secure units are closed, but in fact, if residents in every home, if there are cases, they are restricted to stay either in their bedrooms or on their floors. So it's not just those residing in secure home areas, but as Dee mentioned, we have started to compile a number of programming resources to support and counteract some of the boredom, the isolation, the loneliness. And Sophia from the CLRI also noted the Boredom Busters is being translated into French as well. So that resource is now bilingual.
Great.
There was another question about who makes the decision about residents being sent to hospital. Nurse practitioner programs are being piloted by the Ministry of Long-Term Care, leaves the decision with contracted service providers. So I think it's just kind of the flow of discharge to hospital and how that's working.
Yeah, I personally don't have any information on that other than it would be the physician with the nurse practitioner and the family member, if the resident is not capable of making those decisions on their own, making a decision as to what the wishes are of the person in terms of their care plan, and seeing if they really would like to have care provided at the hospital.
There was another question about discharging a resident or having a resident coming home with family during an outbreak. What is the policy with regards to moving a resident out of a home that is experiencing an outbreak? Can they remove all of their belongings at that time, or is there going to be delays because the family can't come into the home to do that discharge?
Yeah, I mean, ideally, what happens, because the resident is formally discharged the day that they move out of the home, all of their belongings ideally should be taken or stored. Many homes don't have the room to store belongings from residents, so I think that really is a conversation that needs to take place at the respective home with regards to what their process is. Because really what the goal is if a resident is discharged from the home, the idea is that room is available for someone else. So it really is a precarious situation that needs to be discussed through with the home in question. And Sam, I'm not sure if you have anything else to add to that.
I'd say that's, you would need to be, families are responsible for, as far as I know, figuring out how to store the items or whatnot. You generally wouldn't be, I'm not sure if you can take your person out while the home is actively in outbreak, but I do know that during the time the person's away, the bed is available for another person. And the process for returning to the home depends on if the person's absent for 3 months or longer. So that's another important thing to consider is how long the person would be home in the community, because they wouldn't be able to move back into the long-term care home while there's an active outbreak.
Thank you, Sam. There was one question about the new emergency order limiting workers to work only in one home. So the question was kind of around enforcement. How can family members be assured that this is happening? How will this be enforced?
Well, I don't know what safeguards in terms of enforcement are put into place, but it is law, and it is. I don't know what the penalties would be, but it is absolutely law now in this situation. So that is something that we can certainly find out for you, find out what checks and balances are put into place to make sure that this is the case.
Excellent. There are a number of questions around testing, the turnaround time for testing, who is a candidate for testing. And I know those are things that we have touched on with both of our organizations respectively in our bulletins, Dee.
Yes, indeed. So there are different forms of the test available. That is something that OARC and FCO is asking our ministry for clarification on at this time. You know, which specific tests are being used, because to have a test and to not have the result for 4, 5, or 6 days, in our mind, kind of defeats the purpose, because you can be asymptomatic and still have COVID-19. So especially when resident cohorting is a requirement as well, to cohort residents who have COVID-19 away from residents who do not have COVID-19, the turnaround time needs to be much, much quicker, and those tests are available. So we're advocating that the tests that are provided to long-term care are indeed those quick turnaround tests, some as quick as within the same day.
Thank you, Dee.
There was a question that I did see about when is it going to be available for everyone in the home to be tested. And to date, that is not the directive from the ministry. The directive, as Sam alluded to earlier, was that if there is a resident who has COVID-19, all team members, all staff members on that unit are tested. All residents in adjacent rooms are tested. And all essential visitors who came into that unit are tested. And then it's the public health unit's decision as to whether further testing for other people is required. So let's say other residents who may share the same dining table, for example, they may not be in adjacent rooms or share the same bedroom, but if they are eating at the same table, then those are decisions that public health makes in terms of the number of people who are tested around the contact for that person who has a positive results to the COVID-19 test.
There were a few questions around volunteering in the time of a pandemic. How could a family member become a volunteer? Concerns that there's kind of inconsistencies from home to home around allowing volunteers and some organizations not allowing this. I know there was a request for statistics, but it's still very early and we don't have that information, but I'm not sure if you could speak to the use of volunteers at all.
Sure, I can jump in. So my understanding is that along with the other staffing measures, homes have flexibility to use volunteers and hire other folks to meet the needs of that unique home and its circumstances. As for volunteers, they would need to be providing some sort of essential service. So it would be things that are essential to resident care and safety. So it wouldn't be just anyone could go in and volunteer. You'd need to be providing an essential service and working with multiple folks, ideally. So whether well or ill residents. So once again, it's not an open the door, let anyone come in situation. It's specifically for those essential tasks. And people would need to contact the home to find out more about the process.
Mm-hmm.
We have a question from a resident. What if homes say that families or friends are not allowed to deliver items to residents, such as flowers or toiletries or items desired by the residents? There are some restrictions in terms of what can be physically brought into a home or even dropped off at the reception.
That's an excellent point. Excellent point. I raised this actually in a call a couple of weeks ago, and really it's the public health unit that has jurisdiction over those types of things, because we know that the virus can live on hard surfaces. We know that for a day or two or three, depending on the surface, the virus can survive. So public health gives guidance with regards to how parcels can be either disinfected or left in a room for a couple of days. So really that question needs to be directed to the management of the home that you're living in or where you have a loved one, and to see what guidance the public health unit has given that home.
Excellent. Now would you like to move on to our next slide, Dee and Sam? Or I know there's
Sure.
some outstanding questions, some excellent questions, and there was a suggestion that responses be posted in kind of a Q&A format on our respective websites. I know you mentioned we will endeavor to include some responses in an upcoming bulletin.
I think all of our bulletins are on our website already. So what we'll do, at least for OARC, we will create that joint bulletin and put it on our website in a very conspicuous manner so that you'll be able to know that that bulletin deals with the questions from today's webinar.
Excellent. Thank you to everyone for taking the time to submit questions in the chat box. There's some excellent questions that have got our wheels turning. So I'll just hand that back to our presenters here for a summary.
Thanks, Melissa. So in summary, this is a time of incredible change. This is pulling and stretching us in ways that that really are quite remarkable. The directives that we reviewed today and others that we didn't touch on today really are in place to keep residents safe. The restrictions on visiting, on communication, on testing, all of those directives are really intended to have a clear picture of where the virus is in the home, what's happening, how to best constrict its transmission, and make sure that residents are kept as safe as possible. We reviewed a number of toolkits and resources. The webinar will be archived on our website. We'll also highlight what, the various links to various tools and resources in that bulletin that we'll put out next week. We talked about the power of togetherness. We will get through this together, and we will have lessons learned. We will have change that will, we can assure you, I know Samantha and I have talked about this, we will advocate in a way like none other, that the positive changes that are going to be birthed out of this experience must last. They must be sustained, they must last. And of course, we reviewed some bright lights, and we encourage you to share with us if you are part of a bright light idea yourself, if you are going to try something new from what you heard today, what you saw today, please let us know, stay in touch. It's important that we be able to share these bright light ideas broadly so that every long-term care home in Ontario has a pool of creative ideas to try.
And I think that we also need to keep in mind the hope and everything that's going to come out of this at the end, because as Dee said, we won't stand for things going back to the status quo, because we know now that there are things we can do better. So collaboration has come to the forefront at the home level and systems level. We're seeing organizations step forward saying, how can I help, in a way that is simply unprecedented. We've seen a lot of creativity, a lot of emotional connection. We hope that there will be a richer, more beautiful experience in long-term care once this is done. And recognizing that the changes being made to address human resources issues, those solutions we're seeing now, will be the new normal. So we are looking forward to having an increased awareness of the value, the vibrancy, the excellence that exists in long-term care, because it is a great place to live and to work. Right now, I know things are challenging, especially for not being able to see your loved one, not having that in-person connection. But when we get through this, we will work towards making sure that the positive outcomes that we're seeing will be sustained. Back to you, Dee.
Great. So thank you, everybody. Really, this is an honor to be able to work on behalf of residents, and an honor, I'm sure, for Sam to lead an organization that represents family councils. We are in this for you, with you. We will do this together. We would encourage you, please, to take a couple of moments to fill out the evaluation. It will definitely help us to serve you better. And if you were not able to articulate your questions in the chat box. There's, please take the opportunity that is available to you in the evaluation form to jot down your questions. It'll take us a couple of days to collate all of the outstanding questions and responses, but please have a look out for our bulletin coming out next week. We wish you well, we wish you joy and happiness, and again, we are in this together. So be safe, be well, and connect with us for any reason at all. We're here to support you.
Yeah. And thank you for spending part of your afternoon with us, because we need to hear from you in order to be able to do our job. So we so appreciate your time, your attention, and your thoughts. Thank you.
A very big thank you to our co-presenters today, Dee and Sam. I have linked our respective websites on this last slide, so you can access the bulletins, but please reach out to us if you would like to be added to our distribution list to receive these notices in your inbox. Thank you again, and have a lovely afternoon, everyone.